Doctor, if you extract my upper teeth, will I go blind? Or will my eyesight become weaker? This is a common question I have been asked way too often in my clinic. So I thought, let's bust this myth once and for all. This is a question that's been passed down from generations to generations here in India. But what it really is, let's find out. Hi, I am Dr. Salman. Welcome back to my YouTube channel. Today I am going to break the myth on whether extraction really can cause blindness. If you like my content, do consider subscribing, and I will come with such videos week on week. So this belief is a very common popular myth in many parts of India, especially more common in the northern parts. But what it really entails, see, yes, your upper molar teeth, anatomically this tooth structure is very close to your eyes. It's in the maxillary bone, right? But no, the nerves that supply the upper molars is trigeminal nerve, and it's nowhere connected to the optic nerve which supplies to your eyes. The optic nerve is situated deep behind your eyes. So there is no chance that removal of a tooth can lead to blindness. But why do so many people think that this has happened, or from where did this myth come from? See, this is possible that someone in the older generation, they went down for an extraction and an extraction was done, and after extraction, maybe after a week, 2 weeks, 3 weeks, they develop poor vision or they develop blindness. But why did they develop this blindness? It could be because of age, it could be because of hypertension, it could be because of diabetes, it could be because of any other infection. But they directly connected it to, oh yeah, you know what, last month I went and got my tooth extracted, that's why now I am blind. See, this is similar to telling that if you watch Netflix, you're going to get heart attack, right? Someone would have watched Netflix last night and this morning he passed away. That does not mean watching Netflix is the cause for heart attack. So it must have been coincidental. It has been misinterpreted, and over a period of time that fear, that stigma has still passed on from generation to generation. So now even in 2025, I'm really shocked and surprised when some of the patients, especially the parents, they come and ask me, doc, but will his eyesight be okay? Upper teeth, it's very near to the eyes, is it not dangerous? So no, it's absolutely not dangerous. But let me tell you what is dangerous. Here are a few signs that you must be cautious about after you've done an extraction, and report to your dentist immediately if you see a problem. One is excessive facial swelling, right? So let's say you removed a tooth in your upper arch and the whole face is swollen and the swelling is not going down. Or let's say there is continuous bleeding and the bleeding is not going down. Or let's say there is continuous pus discharge that's not stalling, or you develop sudden fever unexplained and the fever is very high and it's not coming down, and you have pain, that is sharp pain which is absolutely not relieving. So these are the common things that post extraction, if you develop these signs, then you need to be cautious and your dentist needs to be notified immediately. So now let me be clear. So if it's a case of medically compromised patient where we are doing an extraction which already has multiple infections, and that infection spreads to the top of the bone, very rare complication, maybe 1 in maybe 100,000 patients, maybe 1 lakh, 2 lakh patients, yes, a blindness can happen, but that's not happened just because we extracted the tooth. That's happened because the patient has already been suffering from many other conditions. So I will not say 100%, I will say 99.99% dental extractions will not lead to blindness. So if you have heard this myth growing up, send this video to your parents, grandparents, or your elders with whom you've had this debate, and you can clear up their doubts. And if you want such honest dental advice week on week, consider subscribing to my channel. Till then, see you, bye.